During the years of 2013 to 2015, Louisiana had 8 deaths per 1,000 live births. East Baton Rouge Parish had 12.8 deaths per 1,000 live births. When we look closer at the parish, we see where we run into racial disparities. Among Hispanics, we had 15 deaths per 1,000 live births. African Americans, 17 deaths per 1,000 live births. And that is compared to 5.7 deaths of Caucasians in this actual community. So you see, we have a lot of work to do. Between 2013 and 2015, we were ranked 3rd in the nation for having one of the highest infant mortality rates in the country. Louisiana now has lowered that number, and we are now 4th in the nation. But there is much work to do. So I'm going to have Michelle Littleton, our program director of Healthy Start, to give you some more stats of what we're facing and how we can address the problem.
Some causes are birth defects and lack of prenatal care, preterm and low birth weight babies, and SIDS and SUIDs. So in order to combat that, we can do certain things to prevent this from happening. First of all, we can encourage our moms and dads to get early prenatal care and preconception care. We can practice safe sleep practices with our babies. We can stop smoking, which adds to the preterm and the low birth weight babies. That's tobacco use, marijuana use, and vaping. We can not be around secondhand smoke, which also affects our babies. We can make sure we're eating right and practice good nutrition. And so here is where Healthy Start comes in. We have an awesome program with an awesome team who goes out and provides case management and home visitation to all of our moms and dads, one-on-one. We meet them where they are. We go to doctor's appointments with them. We go to their home. We go wherever they want us to go to meet with them one-on-one and give them health education on safe sleep practices, on nutrition, through the LSU Ag Center. We have sonograms that we provide for our moms through BRCC College. We also provide breastfeeding classes because our case managers are breastfeeding, certified breastfeeding. We also provide car seat safety classes. They are certified car seat safety technicians. So we do all of this in an effort to make sure that that baby reaches a healthy, have a healthy birth outcome. We follow the mom and dad and their whole family until 18 months of age. And that is a time where we feel they are comfortable and healthy enough that they can strive and make it beyond the years and have a productive, family environment with their parents. We cover East Baton Rouge, all of East Baton Rouge Parish. We take moms and dads preconceptually from 11 years old to 45 years old. We take the pregnant women, their father, their partner. They don't have to be in a relationship because we all know that the father is just important to a family unit as the mother. So we want to help the whole family. As I said, we provide all of these services and we try to enroll our moms and dads early as possible so we can be there for the long haul and make sure that they are practicing safe practices from day one when they find out that they're pregnant. We provide them support and resources, and if we don't have a resource, we go into the community and find the resource that they need, whether that's housing, food, whatever the case may be. Because we want everybody and every baby to have a healthy start. Thank you, and now we will have words from Dr. Hunter from the Governor's Office, the Children's Cabinet.
Really touched and humbled because 21 years ago, my husband and I were pregnant young. At the tender age of 18, he was 19. And I came through Family Roads at the age of 18 years old. And I remember the services that we got. I remember the education that was provided. And I remember how helpful it was as a young mother to have support from a program such as Family Roads. And I'm so blessed and proud to say that my children, our children, are now in college. Our oldest are 21 and 19 years old, attending the flagship university, LSU. And our younger two are 16 and 17 at Lehigh. And I cannot imagine where we would be had it not been for a program such as Family Roads. And I'm so grateful. And my heart is just touched and overwhelmed when I look and see some of the young couples and young families that are here today. It makes such a difference, programs like this.
Yes.
Because every family does not have family support. Every family does not have a grandmother that they can go to and say, hey, can you help me with diapers? Can you help, share with me information on why I should not smoke, why I should not drink, how harmful this is to my body. And so the information and the work that you guys do is just vital to our community. And for that, we say thank you. And I say thank you. Governor John Bel Edwards is an advocate for infant health and maternal health. Most recently, we signed a partnership and we joined with Senator Regina Barrow with her Empowering Families to Live Well Council. We received a grant from the Pew Charitable Trust Foundation and Robert Wood Johnson Foundation to address maternal health right here in the state of Louisiana. We know that maternal health and infant health is so important. We know that moms and dads have stressors and other social determinants of health that preclude them and that prohibit them from having healthy babies. So as a state, from the governor's office on down, we want to do what we can to help support families, to better wrap our arms around families, to better understand what families need so that they can live well, as Senator Barrow's council and DCFS, the council, the name of the council, Empowering Families to Live Well. We want more families in our state, black, white, blue, green, yellow, more families to live well. Because when families live well, these beautiful babies live well. And that's our goal. So again, on behalf of our governor, I want to say thank you for this program. Thank you for being here. Thank you to every one of you that support this work. Thank you to our mayor, who is a champion for infant and maternal health, our senator as well. And we have a proclamation that I'd like to read and present to you today. It reads, John Bel Edwards, Governor, proclamation, whereas the Infant Mortality Awareness Campaign has been designed by the National Healthy Start Association to increase the community's awareness of high rates of infant deaths. And September 9, 2019 marks Infant Mortality Awareness Month, as infant mortality continues to impact our families and communities. Infant mortality refers to the death of a baby under 1 year of age, and premature birth, low birth weight, and birth defects are among the leading causes of infant mortality. Whereas the Family Road Healthy Start Program and other organizations have worked diligently to provide services to women and their infants. And whereas Infant Mortality Awareness Campaign provides opportunities for communities to get involved and to promote better health for mothers, babies, and families throughout Louisiana. Now, therefore, I, John Bel Edwards, Governor of the state of Louisiana, do hereby proclaim September 2019 as Infant Mortality Awareness Month in the state of Louisiana.